I work with adults and they range from 18 all the way up to the 90s. So we see quite a big range of people in our services. I was just wondering, just my own... that better? I was just wondering, just for my own benefit, how many people have worked in adult services or have used the cards in adult services? Just me. Okay. Okay. And Kate. Okay, that's good for me to know. So hopefully today this is going to be a really good opportunity for you to understand how we use the cards and services with adults and the adaptations that we make as well. A lot of what we do is quite similar. I've noticed some really common themes from children to adults, but that's something that we can talk about throughout the presentation today. Also, there's two more of my colleagues on the board. They're really sorry they can't be here today, so you're just stuck with me, I'm afraid. Okay, so I thought it might be useful firstly is to go through who I am and what I do, just for a bit of context. So, as an associate psychological practitioner, or APS, because it's quite long-winded, so we provide low-intensity psychological intervention for patients who are experiencing low-level anxiety, low mood, stress, worry, just lots of different aspects of your mental health and well-being, really. We use a variety of different techniques and approaches, so that ranges from cognitive behavioural therapy, compassion-focused therapy, acceptance and commitment therapy, and dialectical behavioural therapy, just to name a few. So the beauty of it is that we can pick any approaches or techniques just depending on that patient's needs and where they want to be and the goals that they set as well, and that's where the next step cards can come in really handy as well. So we offer 5 sessions of one-to-one support at the practice. They're every 2 weeks and they're up to an hour long as well. And we aim to promote wellbeing, prevent deterioration of mental health, both within primary care and within the community as well. So that could be through events or community outreach, different things like that really. So we work in a primary care network. However, some apps might support individuals in secondary care services, community services, educational settings as well. So we're just everywhere at the minute. So I thought as well it might be useful to go through what primary care is, if anybody doesn't know what that is at the minute. So primary care is a group of services that provide the first point of contact in a healthcare system. So it acts as a front door to the NHS really. It's that first point of contact that people experience when they're accessing support. So primary care includes general practice, so GPs, community pharmacies, the dentist, the opticians, and a few more as well. So what is a primary care network? So a primary care network, it's a group of GP practices and their aim is to provide a greater provision of care within the community. We work really closely with other clinicians in the PCN as well as apps. So this could be with the pharmacists, physios, care coordinators, mental health practitioners and paramedics. We've got quite a big team within our primary care network and it's really great because we can address so many different needs just in that one place. I've also put an interesting fact at the bottom. I was going to say it's a fun fact, but I'll let you make your mind up on that one. So research has found by Lloyd in 2024 that having one app in 41 PCNs in Lancashire and South Cumbria could provide 53,000 brief intervention appointments. And this could also free up at least 1,665 GP appointments in 1 year. So it just goes to show the impact of having that support right there in the practice, both on the service and waiting lists, but also for patients as well. And then I've just spoken a little bit about apps within Picton PCN. So there's 6 GPs in my PCN. I work in 2 of them at the minute. We provide assessment, structured formulations and brief psychological interventions to help meet their presenting needs. Clinicians within the GP practices, they can refer to apps and GPs can as well. And we aim to bridge that gap between primary care and secondary services. So a lot of GPs might refer straight to talking therapies. What we aim to do is be right in the middle, so GPs can refer to us before the mental health deteriorates, just to prevent the mental health getting worse, basically. So it can be really, really useful in the community, and like I said before, for waiting lists as well. Okay. So, using the Next Step cards in app sessions. So, as an app in GP practices, we tend to find the Next Step cards to be most useful at the start of the sessions to promote a good sense of direction throughout the patient's journey. If they feel that they've done well and wanted to continue setting goals for after the sessions to stay motivated, we might look at the cards again and compare where they were at the start of the sessions, which helps facilitate that conversation and acknowledge the progress that they've made and plan for the future. So I often use the picture on the left when I'm working with my patients, just because I think it's a really simple way of understanding goals and the steps that we need to take to meet their ultimate goal, and breaks it up a little bit and makes it more manageable. So it helps them understand that our sessions are a journey and things may not necessarily happen overnight, in that it might be more helpful in the long term to break up these steps when looking at their goals, making sure that they're specific, measurable, agreed, realistic and timed as well. So by breaking these goals up into smaller achievable steps, we're able to encourage further goal setting and improve outcomes overall. So one of my colleagues who unfortunately couldn't be here today, she wanted me to speak about the success of the cards. So sorry. This way?
Yeah, I think there's a clash.
Okay, sorry. So she wanted me to speak a little bit about one of the patients that she was working with in her GP practice. So she worked with a male patient in his 40s. She found that by talking through the community cards specifically, they were able to have a more in-depth understanding on positive changes that he could make to improve his well-being. For example, when he placed the community cards on the red position, they had an open conversation about what challenges he faces, barriers, and where he wants to be in the community. They were able to use the level cards to understand where he thinks he is, engaging in the feel, see, think and do elements of the cards, and then use the step cards to map out how he would go from a 4 to a 5, or a 4 to a 6, or a 4 to a 7, whatever he feels more comfortable with. And that's the beauty of it as well. We're able to adjust those level cards according to their needs and what's better for them, really. And that makes the session a bit more comfortable and more realistic as well. So this included exploring his skills, choice and talk step cards as well. Throughout the sessions, he became more motivated to speak to other men in his community, and he joined a service called Andy's Man Club, which is a group in Liverpool, and I think they're nationwide as well. And they offer a lot of support for men who might be struggling with their mental health, and it's like a peer support really. And they do a variety of different things like sports and meet up for runs and things like that. So it's quite a big step for somebody who felt really anxious and nervous when he first came into the sessions. He even joined a community sports team as well. So towards the end of the sessions, he was more open and gained confidence to do things that he enjoys. And he also met his goals when we were using the life cards, and getting more involved in the community. So he was more open and confident as well. During a follow-up call as well, he told my colleague that he even started to organise the groups for himself within Andy's Man Club, and I think that was just an amazing thing. So it's really important within adult services, and I suppose within children's services as well, to note that every service user, client or patient may respond differently to each life card. For example, when I used the cards with a female in her 20s, she became visibly upset when discussing the university, work, friends and the me card as well. So I think that really suggests that these life cards are so personal to each individual that you work with. So this is something that we might not necessarily think about when we're working through the cards with adults, and that highlights how critical it is to be able to adapt whilst working with them and take all of their personal experiences into consideration as well. It's important to create that safe space with them, be present in the room with them and validate how they feel in that moment too. So although some life cards can trigger complex emotions and thoughts, by listening to the patient, for example, the patient that I worked with, We were able to reflect on where she is now and where she wants to be in the future, breaking her goals up into more manageable and less daunting steps. And this created a sense of hope and motivation in the room, which is something that she really struggled to facilitate on her own. I guess more broadly, we found that some patients may find it... Sorry, I'm really not good at this. So more broadly, we found that some patients might find it really difficult to open up in the sessions, particularly if they've never accessed mental health support before. They might be quite scared of speaking about their feelings. I think with the gentleman that my colleague worked with, I think naturally what we've found is that men might find it more difficult to open up as well. So the cards can be really helpful in breaking the ice and being engaged in the sessions as well. They help guide the sessions, and rather than being prompted and talked at by somebody in a GP clinic room, it's more of a collaborative approach we found, and patients feel that they have a voice and they have a say in what happens in the session, and it gives them that element of control back, which is something that they might feel that they've lost over time as well. And they foster an element of interactivity in the sessions. We found that supports the patient to try and be as engaged as possible, which again can be really, really difficult if we find a patient that struggles to open up and struggles to engage. Again, it breaks the ice. It's really, really good for that. During the assessment stages, so that's one of the first appointments that we have with the patients, the cards can aid in understanding aspects of that patient's life that may not normally be talked about with them. For example, the community card or the world card as well. So it can really aid in for us as well to understand different elements of their life, again, that we might not necessarily talk about in a normal assessment. So some apps or practitioners in primary care may find it difficult to talk about risk and safety as well with patients. It can feel like a really awkward conversation. So by using the cards, like the Safe card, amongst other ones as well, they're able to have that open conversation, and it might feel more natural for them. It removes those barriers and ensure that they're receiving the support that they need. And it goes back to the consent and confidentiality that we've spoken about today as well. Having that conversation with them, letting them know that we can support them from a primary care perspective. Okay. I've also, on the slide, I've noted the use of the 5 ways to well-being, which we find really useful in the work that we do. So these are 5 different ways to improve your overall well-being, keep yourself well. Throughout our work, we try and encourage patients to apply the 5 ways to well-being as much as possible. So these are connecting with others, being active, taking notice, keeping learning, and giving to others as well. We found that incorporating the 5 ways to well-being with the Next Step cards to be really useful, and we found some really good outcomes as well in maintaining the patient's well-being whilst they're working towards the cards. We may also use the blank cards too to incorporate the 5 ways to well-being, which is really good as well. So again, it's a gentle reminder of the practical things that we can do to keep ourselves well, generally. Okay. So finally, I hope you found this presentation useful. Overall, we found that using the Next Step cards to be really beneficial in facilitating conversation around the patient's presenting need and guiding the sessions from the first session all the way to the last. This can be really helpful when working with patients who may not be as open to discussing how they feel. They might feel demotivated and prefer a more interactive approach as well. The cards are extremely versatile and adaptable to each patient. They have a choice and they're able to use the cards in a way that promotes positive change, whilst also taking their own personal experiences, feelings and thoughts into consideration. Although the cards were originally created to support children and young people, I think it's safe to say that everybody, including adults, can really benefit from setting goals, feeling validated and listened to, and they also deserve the compassion and understanding that the cards provide. Any questions? Hello.
Do all PCNs have in Liverpool, so I'm thinking more maybe the Walton area? Just thinking of a family I'm waiting.
I know me and my other 2 colleagues are the only ones in Liverpool at the moment. There are some in Knowsley, in a few GP practices there. And then they span a bit further up north as well, towards Lancashire, South Cumbria, and also Manchester as well. But they've also stopped doing the course now too, so I think we're going to go extinct soon. Psychological wellbeing practitioner. Yeah.
Brilliant. Thank you so much.
Thank you. Thanks everybody.
Thank you.